I'm Rain.
I'm Deepa.
I'm Meghna.
I'm Grant.
And I'm Ben.
The purpose of this presentation is to inform you on the very important and relevant topic of public health care, as it comes into the conversation more as Trump has entered office. Public health care is not accessible enough for the general population, and its absence has impacted many people's lives.
The Constitution doesn't specifically mention accessible public health care, but it does imply it and could be interpreted differently in each state. In the preamble and Article 1, Section 8, Clause 1, the Constitution states to promote the general welfare. Health is the key to the welfare of the body. Thus, public health care and general population has the basis in the Constitution.
Current U.S. public health care is a mixed system. Public health care includes Medicare and Medicaid, which does not cover the general public. Some of these people opt for privately financed health insurance. However, the majority cannot afford this luxury. Healthcare is not universal in the United States, and a significant part of the American population lacks insurance.
The laws and regulations set in place in the healthcare system are very important, as they can widely affect the delivery of healthcare in the United States. Currently, the most important law regarding public healthcare is the Health Insurance Portability and Accountability Act of 1996, which focuses on protecting the privacy of patient healthcare information by governing the activity of business associates.
The most critical executive ruling occurred on July 30th, 1965, when President Lyndon B. Johnson signed the Medicare and Medicaid programs into law. Medicare, a federal health insurance, and Medicaid, a joint federal and state-run program, are agencies super important for those who have limited resources, and that's why their enactment was one of the most crucial executive rulings.
In the 2012 Supreme Court case Belsis v. Sebelis, the Supreme Court upheld the individual mandate but decided that it was unconstitutional to withhold funding due to non-compliance with Medicare expansion. The individual mandate required citizens to have health care or face financial penalties, while the Medicaid expansion attempted to expand Medicaid to low-income adults.
Public opinion on public health care in the U.S. is mainly negative. The government is not actually providing them with help, prioritizing profit over patient care. Recently, United Healthcare CEO Brian Thompson got shot and killed by a protester who was angry about limited healthcare access for the poor.
France went from having limited coverage to one of the most successful public healthcare services in the world. It is a universal, mandatory system that covers almost all residents. People are required to have at least the most basic insurance, with many using private supplemental insurance to cover additional costs or gaps in coverage.
The United Kingdom's National Health Service has recently been facing issues due to having a shortage of staff and being underfunded. Because of this, there have been much longer wait times, which makes it hard for people to receive treatment. As of 2023, over 7 million patients were on waiting lists, which made access to healthcare extremely difficult, especially towards minorities and those in poverty.
The American Association of Nurse Practitioners is a prominent supporter of universal health care. They strive to create high-quality, affordable, equitable health care for all. Last year, they spent a total of $1,550,000 on empowering nurses, educating the public on ways to access affordable health care, and advocating for the government-subsidized health care.
Last year, the American Medical Association spent a total of $25 million lobbying for many things, including against healthcare for all, claiming it would cause immense financial strain, place a burden on patient choice, and decrease the effectiveness of the system. Many other pharmaceuticals have joined in against healthcare for all, saying that it would decrease drug innovation.
Most conservative states don't deal with the public health issue directly with the government. Usually, they opt for market-based solutions like health savings accounts and HSAs, high deductible plans. It is more individually based than the government. Overall, they do not provide real help or work with the government to solve this issue. They just provide advice to save money.
Massachusetts, a liberal state, boasts one of the highest percentages of residents with health insurance in the United States. Its healthcare system is primarily centered around Mass Health, which combines Medicaid and CHIP, which is for children. Mass Health provides health insurance and financial assistance to children, families, and seniors living in the state.
In 2021, Senator Bernie Sanders introduced a bill called the Medicare for All Bill, which is an act that would provide a single-payer health insurance system by covering everyone globally through Medicare. The bill's purpose would be to replace private insurance and cover all medical services. However, it has yet to pass and is still being debated in Congress today.
This issue is currently under the control of President Donald Trump and is foreseen not to improve, but rather it is foreseen to decline. The decline will be slight, but it will impact people substantially. President Trump has said there will only be modest cuts to Medicare, but significant cuts towards Medicaid. This would leave a lot of people in a worse situation than they are now currently.
The information we presented was found on the World Health Association website, Open Secrets website, Maryville University, Massachusetts Commonwealth website, and the Brookings website. Thank you very much for listening to this presentation.